Aloha and welcome to Queen's Speaking of Health lecture series. Tonight's lecture is called Deciphering Dementia, Screening, Diagnosis, and Treatment. My name is Lisa Sakia. I'm with the Queen's Health Systems, and on behalf of Queen's, I welcome you all this evening. At this time, it is my privilege and pleasure to introduce you to our main speaker for this evening, Dr. Gina Fujikami, who is a geriatrician at the Queen's Medical Center. Let's give her a warm round of applause. She received her Bachelor's of Arts in Human Biology at Stanford University. She went to med school right here at the John A. Burns School of Medicine. She did her internal medicine residency and chief residency at Santa Clara Valley Medical Center in San Jose, California. She did a geriatric fellowship at the University of California, San Francisco. She worked in the Movement Disorders Clinic at Stanford and worked as a geriatrician at the Santa Clara Valley Medical Center. Then she returned home, and she is now here at Queen's, where she has joined us since last summer. She is board certified in both internal and geriatric medicine, and I always like to ask our speakers what high school they went. So let's see, what high school do you think she went? There is a connection with Queen's. So Queen's was founded by Queen Emma and King Kamehameha IV. Whoa, 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 that's good, that's a good one. But there's another one that they actually helped to found. Very good, she went to Iolani. So please welcome Dr. Gina Fujikami.
Good evening, and thank you again all for coming here. And it's very heartwarming to see the interest that we have in the community about this potentially life-threatening and devastating disease. So thank you for taking your time and coming. And I know all of us here probably have been affected in one way or another by dementia. So hopefully I can share some of pearls with you, and definitely please stay for questions afterward. So let's proceed. So the objectives of my talk are: what is dementia? What are the different types? How is it diagnosed? What are the treatments? And most importantly, how can it be prevented? So I thought I'd share with you some clinical, loosely based examples on some clinical patients of mine. So let's meet Mr. A. He is a 75-year-old gentleman. He has diabetes, high blood pressure, a history of colon cancer that thankfully he was treated and is in remission. So he tells you, you know what, doc, sometimes I misplace my keys, but I can find them. And it's just bothering me because I bumped into my friend yesterday at Ala Moana and I couldn't remember his name. But it took me a while, but by the time I drove home, I did remember the name. He smoked for about 20 years ago, but he quit and drinks an occasional beer. He's on medications for diabetes, high blood pressure, and aspirin. He asks you, do I have dementia? How many of you think he might have early signs of dementia? Okay. All right, we'll talk about this a little more later. Let's meet Mrs. B. She's also 75, has depression, hypothyroidism, trouble sleeping, and some seasonal allergies. She says, you know what, I feel tired. I miss my husband, he passed away. I couldn't find my car at the mall the other week, and I have trouble remembering to take my medications. And you know what, I don't think I have any hearing problems, but my son keeps telling me that I'm hard of hearing, but I don't believe him. She doesn't smoke, doesn't drink alcohol, and her medications are thyroid medicine, sleeping pill, and Benadryl for allergies. I asked the same question. Does Mrs. B have dementia? Show of hands if you think, okay, so a little bit more concerns, okay? And last example is Miss C, also 75, had a stroke, high blood pressure, and high cholesterol. She's gotten lost driving in her neighborhood multiple times, had her utilities bill she forgot to pay it, and so her water bill was turned off. And she's misplaced her ID multiple times and has gone to the DMV to replace it. She smokes a few cigarettes a day, is on high blood pressure, high cholesterol pill, and a baby aspirin. Does Miss C have dementia? Again, show of hands, if so. Yeah, a little bit more resounding yes. Okay, good, all right. So let's start off with the first objective. What is dementia? So essentially, it's damage to the brain. It's memory problems that are severe enough to affect your day-to-day functioning. And when we say functioning, we mean being able to shop, to drive, to take your medicines, to pay your bills. And you know what? An easier, simpler way is you just can't do the things you used to do maybe 20 years ago. I like to think of memory and aging as a spectrum. And so I counsel my patients that there's normal aging, or aging of senescence is the official term, where you occasionally forget things, we all do, but they're not significant enough to affect our functioning. But as the memory problems get more severe, but you're still able to take your medicines and drive, that's what's called mild cognitive impairment, or MCI, or you can call it pre-dementia. And as the memory problems progress, so severe enough that they're affecting your life, like in the case of Miss C, that's when we're entering the stages of dementia. And so I found this nice table from the NIA website looking at some symptoms of normal aging, senior moments, versus signs of dementia. And so normal aging, making a bad decision once in a while, that's perfectly normal. Forgetting to pay a bill once in a while. Forgetting the day. I did that myself today. Forgetting which word to use. And losing things from time to time. That is likely normal. Dementia is when you make more poor judgments many times. Problems with the bills, consistently being disoriented or not remembering the date. Trouble maintaining a conversation, keeping up with the conversation is difficult. And losing things often. So again, signs of dementia. Again, trouble with memory that's not normal for you, getting lost in familiar places, forgetting how to manage your checkbook, not remembering the date, poor judgment, trouble multitasking, trouble speaking, and not as active as you were before. Those are signs, possible signs of dementia. And so I describe dementia as this umbrella term consisting of many different types. And all of you have heard of Alzheimer's dementia, and the Alzheimer's Association is here with us today. So Alzheimer's is the most common type in the world and in America. About 60 to 80% of dementias are Alzheimer's. Second to that is stroke, or what we call vascular dementia. And then there's a few others like dementia from Parkinson's, Lewy body dementia, which has a lot of hallucinations, and frontotemporal dementia, which has a lot of behavioral issues. So I'd like to focus more on Alzheimer's today, as that's the most common type of dementia, not only in the US, but also here in Hawaii. So this is a nice picture of a brain, rather half brains. So the picture of the brain hemisphere on the left is a nice, healthy, plump brain. Looks great. On the right side, as you can tell, there's been a lot of shrinkage or atrophy of the brain, and these holes or the ventricles are bigger. So these are signs that we can see on autopsy or even on some scans of Alzheimer's dementia. And again, it's damage to the brain, and that's why there's some shrinkage. And when you think of memory, most people think of forgetfulness, forgetting, repeating yourself, forgetting words, forgetting things. But memory encompasses other things, like being able to drive, being able to speak, being able to understand and feel, and balance issues. Memory affects us in many ways than just short-term memory. And this is a nice picture on a microscopic level of a patient with Alzheimer's. And as you can see, these are neurons in the brain, and that brown ball of pollen-looking thing, that's called beta amyloid plaques. And these develop and cause damage to a brain in Alzheimer's. Similarly, these blue fibrillary tangles are called tau fibrillary tangles, and these also accumulate in the Alzheimer's brain and lead to damage, which leads to Alzheimer's dementia. So I'll come back to this picture later on in the talk about potential treatments. So why is everyone so concerned about dementia? And just a show of hands again, how many of you know someone or have been affected in some way by someone with dementia? Yeah. And growing up, my grandfather had dementia as well, so I was exposed to an early age to this devastating disease. So why should we care? So not only does it affect us, but it affects our loved ones. 5.8 million Americans currently have Alzheimer's, and this number is actually expected to grow with the baby boomer age, the silver tsunami. People are living longer. Alzheimer's is going to grow and increase. So it's expected to increase to 14 million Americans by the year 2050. It is actually the 6th leading cause of death. And bringing it home, closer to home to Hawaii, over 28,000 people currently here have Alzheimer's disease. And approximately, it works out to about 10% of our senior citizens having Alzheimer's dementia. And we're finding that 1 in 3 seniors have some sort of dementia at the time of death, and they may not have been diagnosed previously. And predominantly women. So if you look at that, again, Alzheimer's is associated with age, and so this is a nice circle graph looking at the different ages of people with dementia. And as you can see, the blue and the purple, it predominantly affects our eldest of the elderly. So people in their 70s and 80s have a higher chance of getting dementia. And again, this is a picture of looking at over the next 20, 30 years of the growing rates of Alzheimer's. And currently here we are in 2019 with about 5.8 million Americans with Alzheimer's. Again, by 2050, look at that, it's going up to 14 million. So we really need to do something about this. And this actually kind of really hit home that, with our advancing medical technologies, we are treating cancer, HIV, heart disease much better. So the rate of deaths has gone down for these diseases. But look at dementia. It's actually gone up for the amount of deaths. And I'm sure everyone knows some of these famous celebrities. So celebrities are also affected by Alzheimer's disease as well. So what should you do if you are worried about your memory or your loved one's memory? See your primary care physician. He or she is the one who knows you best and can initiate the workup. There was actually an article that came out a couple months ago about how few seniors are actually getting routine memory checkups. And it's actually not recommended for people to get routine memory checkups right now by the United States Task Force. So definitely, if you feel that there are some memory issues, please voice it and bring it up with your primary care physician. There are other causes of memory problems. It might not just be dementia. It might be untreated thyroid problems. Low vitamin B12 can cause memory problems as well. An infection, like a UTI. Medication side effects can also contribute to grogginess and memory issues. Untreated sleep apnea, depression, hard of hearing, as well as poor vision. So how do we diagnose this? So a good history and physical exam. We like to get information from friends or family members because oftentimes patients themselves with memory problems might not be the best informants. We also make sure we've done some routine blood tests to check, for example, the thyroid or B12. A brain scan may or may not be recommended, and this may take multiple visits to diagnose. And unfortunately, for any type of dementia, there's no cure, and it is a progressive disease as well. So what can we do? What do we have control over? So there's exercises, physical aerobic exercise, as well as mental exercises. Making sure that your high blood pressure, high cholesterol, and diabetes are under control. Getting good sleep, which I think is the hardest thing to do, but getting a good 7 to 8 hours of sleep can be very refreshing and restorative. Eating a healthy diet, and I'll go over more of this a little bit later about what that entails. And we do have some medications, but again, these are not cures. They are trying to slow the progression of the dementia. So you might have heard of donepezil, or Aricept is probably the most common. There's rivastigmine and galantamine. And then there's something called Namenda as well. And again, these medications in our experience are so-so. They don't really work that great, and there could be a lot of side effects. So it's important to discuss this with your physician. So what do you do after diagnosis of dementia? Quit smoking. We definitely know that stopping smoking can help slow the progression of the disease. Start those medications if appropriate. And there are many clinical trials going on that if you are able to enroll in, which would really enhance our knowledge of the diseases and may help. Talk with your family. You're going to need their support as the disease progresses. Being aware of safety. How many of you have heard of loved ones wandering outside of the house? It's dangerous. So planning for like a medical alert bracelet, planning for locks if safety and wandering is an issue. And future planning. If you can catch the dementia early enough, the patient can still be able to make some decisions for themselves. So when it comes to financial planning, living wills, advanced care planning, it's important to do that while the loved one with dementia has the ability to. And sometimes with dementia, behavioral issues can develop. Agitation, depression, and so educating caregivers on how to deal with these mood swings and mood disorders can help, as well as knowing what to expect as the disease progresses. And unfortunately, with dementia, with the increasing prevalence of it, the medical costs are going to be extraordinary, and so even up to trillions of dollars, healthcare dollars, over the next couple decades. And so being able to plan early about long-term care it is very helpful in cost savings to families. So some tips for reducing dementia risk and other non-medical treatments for dementia. So let's talk about diet. How many have seen this Choose My Plate? Yeah. Does anyone remember the pyramid, the food pyramid? Yeah, so that doesn't exist anymore. Now the government does this plate because it's easier to understand portions than the pyramid. And so in general, a healthy diet consists of maybe about a quarter protein, quarter grains, quarter fruits, quarter veggies, and a side of dairy, whether it be milk or yogurt. Now, there's been a couple of types of diets that have specifically been studied in patients with dementia. And there's this DASH diet that's been studied for high blood pressure, and some of you have probably heard of this type of diet. It involves vegetables, fruits, whole grains, low-fat dairy, avoiding red meats, and eating more fish and chicken and nuts. Try not to eat as much sweets or processed foods. Easier said than done, but this is the DASH diet, one of the diets that's been studied for dementia. And this is what one of the menus look like. So for example, for breakfast, a cup of oatmeal with some skim milk, blueberries and a cup of juice, half a cup of juice. Snack is usually fruits or yogurt. Lunch will be a sandwich, tuna sandwich, with some salad. Again, snack is another, like a fruit or banana. And then dinner, so choosing the leaner sources of protein, so chicken breast with vegetable oil and vegetables with brown rather than white rice. So this is an example of a DASH diet menu. How many of us adhere to this type of diet? Yeah. Oh, good. You have to tell us how to be successful with that. It's difficult, but it can be done. You just have to make it a habit. Then there's the Mediterranean diet, and this one is probably the most studied diet for dementia. And it's similar to the previous diets. We're looking at incorporating fruits, vegetables, again, whole grains, legumes, nuts, using more olive oil than butter, trying to limit your salt and shoyu. You can eat red meat, but maybe just limiting it to a couple times a month and choosing more fish and poultry or tofu. And it's interesting, so the Mediterranean diet does involve a little bit of alcohol. Specifically a glass of red wine, for some reason, less for women, and of course incorporating exercise with the healthy diet. And a Mediterranean diet menu looks like this. So kind of similar again. Eggs and vegetables for breakfast, nuts for snack, a sandwich and vegetables for lunch, fruit for snack, and fish with vegetables and rice for dinner. So there was one study that came out this year in the Journal of Neurology looking at the Mediterranean diet, the DASH diet, and this other diet, this APDQS, which is similar to the other diets. And it looked at young people, but it followed them for 20 to 30 years, looking at their diet habits and testing their memory. And it found that having a healthy diet at an earlier age may be associated with less memory problems later in life. And more specifically, the Mediterranean diet showed a good association. And they speculate maybe it's the antioxidants, maybe a little bit of alcohol, which I'm not promoting, and the high omega-3 may be somewhat protective to the brain. But then there's another study that came out also this year showing that there was no association between healthy diet and onset of dementia. And let me get back to alcohol, because I do get asked about this a lot, including by my father, about red wine, and is it okay? In general, if you don't drink, I do not encourage you to start drinking, but some studies have shown that maybe a glass or two of red wine a day may be protective. But again, the studies, I do not recommend it. The studies are very mixed, but this is sort of what's out there that you might find on the internet. Exercise, so physical exercise is very important for preventing dementia and also trying to slow the progression of the dementia down. And so in general, we recommend 150 minutes per week of aerobic exercise. So anything that keeps your heart rate up, whether it be yoga, tai chi, walking, jogging, tennis, golfing. And often you can break it up into 20 or 30-minute increments several times a week. I think it's great for general health, specifically looking at dementia. Unfortunately, the results are mixed. There was one study in Sweden that came out this year looking at women, and they followed them for 40 years. And they found that these women, maybe in their 40s or 50s, when they followed a very healthy aerobic physical activity routine, they had less dementia risk. So there are some studies that say it may help. And the thought is it also improves your high blood pressure, and it helps your diabetes, cholesterol. Maybe it helps with growing some healthy neurons. The jury is still out, but we know that in general we do preach exercise for everyone. Then there's the other exercise, the brain exercise. And as my patients know, I always say if you don't use it, you lose it. And so mental exercise is very key. So reading, taking a class. There's a lot of free senior community classes at our local community colleges. Listening or playing music, art, games, bingo, going to Vegas, and even socializing too. Socializing, you really utilize the brain, and it's good for general well-being. So we highly preach these things as well. And again, I'm coming back to the importance of sleep. So we do recommend 7 to 8 hours of sleep a night. We encourage a good sleep routine, trying to sleep around the same time every night, trying not to nap during the day, and making sure that your vision and your hearing are good, so making sure you see your eye doctor at least annually. Supplements. So I get asked about this a lot. Well, you don't have any prescription medication, so what about trying vitamin E or ginkgo? Well, so I looked at the research out there for these supplements in terms of preventing dementia, and unfortunately, again, the research is very mixed. If anything, maybe vitamin E might be the one that has the most robust research to recommend it for patients with mild to moderate Alzheimer's, but it hasn't been looked at very well in other types of dementia or looked at in preventing dementia. There's selegiline, which is an antioxidant. Again, not too much good results from the research. Ginkgo, no good evidence. Vitamin B, unless if you have a deficiency of B12, then we do recommend B12 replacement. But in general, starting vitamin B routinely, we don't recommend. Omega-3 fatty acids, caprylic acid, which is in Exoda or coconut oil. Again, no good evidence for these supplements, as well as coenzyme Q10. But, in general, I preach that I think it's okay to use these vitamins, but make sure that your primary care doctor knows that you're taking them, because there can be interactions with your prescription medications and might not be good with some medical diseases. So if you do choose to try the supplements, just let your primary care physician know about them. So some other research, just some other dementia updates to let you know about that came out recently. That there was a research study looking at, well, let's try to make your blood pressure really good, under 120, and let's treat your cholesterol to really low numbers. So there was a study that looked at that in those age 70 and higher. But unfortunately, it didn't affect the onset of dementia, trying to really be good about your blood pressure and cholesterol in patients who didn't have any heart attack or stroke history. There was one research study that interestingly linked lack of sleep with increased beta amyloid and tau. And if you remember that picture I showed of the neurons in a patient with dementia, that the beta amyloid and tau balls and tangles can cause brain damage. So lack of sleep can increase these levels in your body. And then there was this new medication called aducanumab. I don't know if I'm pronouncing it properly. It's looking at targeting the beta amyloid to destroy it. Fortunately, not effective. And so the medications, you remember I talked about Aricept and Namenda? Those medications came out in the 1990s and 2003. We have not had a new dementia medication since then. And then there's this most recent trial, the Sprint Mind trial, looking at older adults without any diabetes or stroke. Again, looking at lowering their blood pressure. And it did show that over 3 years, it did decrease the onset of mild cognitive impairment, but not dementia. So again, the jury is kind of still out. But I foresee on the future, in the horizon, doctors might be able to utilize this amyloid PET scan. It's a special PET scan looking at the amount of amyloid in your brain. And we know that sometimes, not for everyone, if you have a lot of amyloid, it can be a higher risk for dementia, but not for everyone. It is out there, but it's currently not covered by the Center for Medicare or Medicaid services. On the future, we might be able to measure amyloid and tau in the spinal fluid, so putting a needle in your back to withdraw some fluid and check for amyloid and tau. Again, these are the markers of Alzheimer's that may be coming in the future to help us diagnose Alzheimer's. But the focus now is because, like I mentioned, we don't have any new medications since 2003 for dementia. So now we're looking at focusing on earlier in life, looking at people in their 40s or 50s and trying to do preventative measures to prevent dementia. And that's where the focus is right now, because we're finding that the amyloid that can build up in the brain actually starts even 10, 20 years prior to onset of dementia symptoms. So in essence, by the time you have dementia, there's already a lot of damage from the amyloid and other things in the brain already. And that's probably why these medications don't work. So let's get back to our 3 case examples. So again, Mr. A, 75-year-old, misplaces his keys once in a while, forgot the name of his colleague, otherwise quit smoking. Let me pose to you again the question, does Mr. A have dementia? Just a show of hands. Yeah, so this one is probably normal aging, but it's definitely someone I would recommend continue following for their memory problems. What about Mrs. B? So again, a 75-year-old female. She's depressed, couldn't find her car at the mall, maybe has some hearing issues, and she's on levothyroxine for thyroid, Ambien for sleep, and Benadryl for allergies. Does she have dementia? Just a show of hands if you think she'd know. Well, a couple people changed their minds. Okay. You know, and this is one where, how I mentioned, you might need several visits before you diagnose possible dementia. She's one of those because we don't know if her thyroid is under control. She's depressed. If you feel junk, you're not going to be able to focus or pay attention. And that can come across as memory issues too. So we need to make sure her depression is treated adequately. Also, her medications. So in geriatrics, we like to deprescribe. We like to try to take off medications that could contribute to memory issues. And Ambien can definitely cause some memory changes, as well as Benadryl. So I would recommend to her to stop them, treat her depression, treat her thyroid, make sure she's getting good, adequate sleep, and then bring her back and retest her for memory problems. So the jury's still out on her, but she might have underlying dementia. And lastly, Miss C, 75, gotten lost, driving, utility, the water was turned off, misplaced her ID. She smokes. Again, show of hands, how many think that she has dementia? Yeah, so she probably does. Yeah, unfortunately. So in conclusion, dementia, again, is defined as memory problems that affect your day-to-day functioning. Alzheimer's is the most common, and unfortunately, again, the dementia and dementia in general is worsening. So it's very important to detect dementia early because there is still a lot we can do. And we recommend a healthy diet, so specifically maybe the Mediterranean diet, aerobic exercise, engaging your brain, whether it's games, reading, socializing, getting good sleep, stopping smoking, and making sure your vision and hearing are okay. And I'm not sure how many of you know about the geriatrics clinic here. Just wanted to pull it in a plug. So this is the outpatient geriatrics team. We're a consult service, so we take referrals from primary care physicians, and we deal a lot with dementia, as well as other things that can happen as we get older, such as depression and mobility. So this is our geriatrics team, and you might recognize a few of them. And this is a picture from our conference, geriatrics conference, last week, where we had some renowned speakers come talk to us. And here at Queens, we not only have an outpatient geriatrics, but we have an inpatient. So hospitalized elderly, we have a geriatrics team for them, as well as house calls and certain nursing homes. So these are some members of our team. And these are some references. And thank you again for listening. I'll stick around to take questions.
Thank you so much, Dr. Fujikami. Okay, so now we're going to open up the Q&A portion. If you have a question, please raise your hand. We have one here.
Why are not naps recommended to supplement night sleeping?
Yeah, so good question. So the question again is, why are not naps recommended? So I think napping in general is okay, but oftentimes it can affect your sleep. So because you're taking little cat naps throughout the day, you're not as tired at night. So that can affect your nighttime sleep. So we tell patients, try not to nap so that they're truly tired at nighttime, and so that might help improve their quality of sleep.
Okay, raise your hand. Oh, go ahead.
There's a new book out.
Mm-hmm.
Of the DASH diet and it also has an accompanying cookbook with it. You can order it at Barnes & Noble and probably find it on Amazon too.
Oh, good to know. Thank you for letting us know. I haven't seen that. I'll make sure to check it out.
Okay, we have a question here.
I was surprised to hear that vision and hearing impairment could be one of the symptoms of Alzheimer's. And I was wondering whether you could go back to one of your earlier slides where you showed the brain, in terms of the functions of all the different hemispheres and lobes. And if you could just show us where the vision and hearing occurs, and if you could answer also where the plaque normally accumulates, in what part of the brain?
Okay.
The hard one.
So good question. So let me clarify. Having hearing or vision problems, it's not a sign of Alzheimer's or dementia, but it can be associated with onset of memory problems. So if you can't hear as well, and you're not able to communicate as well, if you're not able to see as well, those can affect your brain and possibly increase your chance of dementia. But having hearing or vision problems is not a sign, one of the signs of dementia. And then your question leading to where are the vision and the hearing centers of the brain? So again, the vision is this occipital lobe, which is the green lobe in the back of the brain. That's where your vision center is. And in terms of your hearing, it's the temporal lobe on the sides of the brain. And plaques, these amyloid and tau fibrillary tangles, so they can develop anywhere. We do know that the hippocampus, which is a small part of the brain, tends to be usually affected in Alzheimer's, but these plaques can develop anywhere in the brain.
Thank you. Go ahead.
Yes, I have a question about sleep. I and most of my friends do not get 7 to 8 hours of sleep at night.
Same here.
We try so hard. I exercise a lot. I eat correctly. I do all the right stuff. And yet I fall asleep. I'm so tired. I wake up at 2 o'clock in the morning, go to the bathroom. I'm awake for 3 hours. I mean, what can we do about that? Your mind just buzzes off.
Right.
Do you have any suggestions?
Yeah, good question. I mean, I think a lot of us can relate to that as well, and we don't have a perfect cure for that. We do know with aging that there are some sleep cycle changes that do develop with age, but because we do know that sleep is important and that deep sleep is important, so I think you're trying to do the right things in terms of keeping active during the day. Again, trying to incorporate going to sleep regularly at a certain time. Maybe spending the previous 30 minutes to your bedtime trying to wind down. Kind of trying to relax. Try not to be on the iPhone or the iPad, because sometimes the glaring lights can also affect your sleep. The other thing we recommend is if you are lying in bed and not able to sleep, so we recommend the bed is for 2 S's, sex and sleep. So you shouldn't be lying there watching television in bed for prolonged periods of time or reading. So if you are kind of stuck in bed, not able to sleep, we do recommend getting up, walking around for a little bit, and then trying to go back to sleep. In terms of for the shishi issue, that's a huge problem, getting up at night to urinate for both men and women. And there are medical treatments for that, which you can discuss with your physician. But I do recommend trying to avoid caffeine at night and trying to limit the amount of liquids that you drink after dinner to see if that helps. So little tidbits, but I know they don't always work for people. And then there are some other medications which I won't go into, which we try to avoid as much as possible.
Thank you. We have a question here.
Is dementia genetic?
Good question. So there is a small group of patients where it is genetic and it's inherited. And these patients, it's what we call autosomal dominant. So a lot of families members will get it, and it tends to happen earlier, like in their 50s, even 40s of the onset of dementia, and it's very rapidly progressive. So there are the genetic forms there.
Thank you. You have a question up there?
Yes. Could you speak on the role that possibly dehydration plays as far as development and exacerbation of dementia? I mean,
Yeah.
as people get older, they tend not to hydrate as well.
Yeah.
And what all happens with that?
Good question. So as far as I know, there's no direct relationship with dehydration and memory issues, but indirectly, yes. If you're not hydrated, it might affect your kidneys, and kidney problems can cause toxins to build up in the brain. If you're not hydrated, you feel tired, you feel junk, you feel dizzy, and that can not be good for your memory because you won't be as active. So I think indirectly, yes, hydration is very important, but there's no direct link to damage on the neurons, but indirectly, yes, for sure.
Thank you.
My question is about your diagram where you showed the illustration of the brain with that one there,
Yeah.
where it shows dementia versus normal brain. What do you call that type of scan, I guess? Is that called an amyloid PET scan, or what is it called?
Yeah, that is probably an autopsy, a slice of the brain. So hopefully that won't happen to you. That's a great question. I didn't include any scans. So this is more an autopsy, what we see when we slice the brain. There's CAT scans right now and MRIs where we can get pretty good detail and size of the brain itself. The PET scans right now, they are available, but they're not covered. And we're still trying to figure out how to incorporate that into our medical practice. So right now it's CAT scan and MRIs.
And how much do those kind of PET scans cost?
Yeah, so I don't have the exact numbers for you, but I know CAT scans can be, and if there's any other physicians out there, I think a couple $100 and MRIs a couple thousand. Usually we can get them covered, but it has to be approved by the insurance first. But usually we're able to get it covered.
Okay, thank you. We have a question there?
Regarding the issue of getting up at night and trying to go back to sleep, I found that if I use melatonin, it does me get back to sleep. So is that okay? I mean, but the thing is that I use it quite often, and I'm just wondering if there's is it okay to?
Right. No, that's a great thing to bring up. So that is something I do recommend for my patients with insomnia or trouble staying asleep issues is melatonin. Are people familiar with melatonin here? Yeah, most people? Okay. So really quick, it's a supplement. It's over the counter. It's a medication to try to help your body increase the amount of melatonin in your body, which your body naturally produces at night to help you go to sleep. And so it's, in general, not many side effects. I've had a few patients feel a little groggy on it, even at the small doses, so just to be careful. But in general, it's a pretty safe medication to take and to try. It does help some of my patients, but in most of them, not as much. But I do recommend it to try it at least.
Thank you.
In your experience, I was just curious, the correlation between seniors and having pets.
Ah, yes. So therapy pets, whatever you might call it, yes, pets are Very helpful in patients with dementia, more the advanced stages who have memory, who have behavioral issues. PETs are definitely very helpful. It brings patients with advanced dementia a source of comfort. Oftentimes we also recommend like dolls also. It just helps control some of the behavior issues that can develop. PETs can also help with mood or any depression or anxiety as well. They can also cause stress too, cleaning up after them, but I think PET therapy is definitely underutilized. Mm-hmm.
Thank you.
Are there any areas that have more dementia in the world, geography-wise?
Good question. I think we're finding that the more westernized countries tend to have it, but there are pockets such as, I believe in Okinawa and some other places in the Mediterranean, and it's thought that have less so, and maybe it's due to lifestyle, whether it be the diet. Loma Linda as well, looking at here in the United States, Loma Linda has a high aging population, very healthy population, and that might be related to the diet. They don't drink alcohol, they don't eat red meat, so maybe that might be related a lot to diet.
So my mom has been diagnosed with sleep apnea, and it's taken a few times for her to find the right apparatus that really works so she can sleep well. But you said that sleep apnea, she doesn't get the right amount of sleep. Do you think she should have like that sleep study checked more often to make sure that she's getting that right sleep? And how does this progress as far as chances of dementia because she has sleep apnea?
Right. So we know, I don't have the exact numbers, but we know that having sleep apnea or not enough oxygen to the brain at night can cause brain damage, among other issues like heart issues as well. And so the way to diagnose it is the sleep study, like you mentioned. And if you are positive, we do recommend that apparatus, that CPAP machine. Normally, we don't, there's not a need to routinely recommend periodic repeat sleep studies to monitor. The pulmonologist or the lung doctor is able to look at the settings and able to titrate or adjust the settings based on the machine readings itself. So usually we don't recommend repeated sleep studies to check the efficacy. Yeah, but to definitely use the machine. Yeah.
How would the medication decrease the progression of dementia, even though if we don't really know the cause of dementia in the brain?
Right. So good question. So the donepezil that I mentioned, or Aricept, so without going into too much of the physiology, it works by trying to increase one of the neurotransmitters in the brain, acetylcholine, to help with the communication between the neurons, to help with the memory. That's only, again, like you mentioned, we don't know enough about dementia and all the different hormones and neurotransmitters. So that's one of the neurotransmitters that might contribute, is this acetylcholine. The other one, Namenda, works by trying to decrease something called glutamate in the brain, and which can cause, too much can cause brain damage. And so that's how those medicines work. And again, they don't affect the tau, they don't affect the beta amyloid. So I think that's why they're not as effective as we had hoped. And there's been, again, a lot of studies like that medicine I mentioned that was withdrawn this year to try to target like the amyloid, and it wasn't effective. And I think it's just because I liken the brain to space. We just don't know enough right now to have good treatments.
Okay, thank you. We have a question here.
I have two questions. One is, can you say something about Lewy body dementia and how is that different from Alzheimer? And another thing, I heard about something called deep brain stimulation.
Yes.
Can that be used for something?
Yes. Sorry, you were asking comparing Alzheimer's and which dementia?
Lewy body dementia.
Lewy body dementia? So Lewy body dementia is, as I said, it's a different type of dementia, brain disease, where it's a lot of, unfortunately, a lot of hallucinations, And then the memory issues, it tends to have a more rapid progression and tends to affect patients earlier. So it's pathologically, the damage of the brain is different from Alzheimer's, because Alzheimer's has like the amyloid and the tau. And Alzheimer's is more later age and more slower and progressive usually. Whereas Lewy body is a type of neurons in the brain that are damaged. So you have movement problems and memory issues. So both are quite different types of dementia. In terms of deep brain stimulation, so right now, so I used to do research at Stanford on this, and in terms of for helping with dementia, not right now. And in fact, we don't recommend doing deep brain stimulation in patients who have memory issues because it actually has been sometimes shown to worsen memory issues. So right now, the deep brain stimulation is not usually recommended.
Thank you. Go ahead.
My case. Okay. Looks like I'm the special case here because they brought up the vocabulary. I'm having harder time to bring out the words, okay? Like, you know that in Oriental country, they use the temperature C, Celsius, and then American, Western country, we use F, Fahrenheit. I couldn't think about that Celsius yet. I was talking with my friend, and I know I feel like that is my brain at this point, shrinking, something like that. And I cannot bring out the words, even though I see visually. Father, my primary doctor, Kaiser, tested me. He said, I'm fine. I was really good at everything, math, everything. And he read sentences backward, and I corrected all that. But he asked me, can you name animals, any kind of animals, within a minute? I was able to only 20. And he said, no. And then guess, I asked the same question. My husband, he said, I can name probably 55 within a minute. And then my doctor said, yes, there are definitely vocabulary problems. So is this he thought maybe it could be cultural thing. As you can see, I'm from a foreign country. I have learned English here, acquired, so maybe I'm in the processing of acquiring, something like that. But definitely, I cannot think of I see the pictures visually. The whale, dolphins, seals, or I could see that, but the words didn't come up. Mm-hmm. So that's why I feel like I know I'm at the onset, at the beginning of this Alzheimer's disease. I really feel it. And then I kept asking, I was thinking another thing is, do I feel first, the patient feels first that you are losing your mind, memory is going away, or other people notice that? Mm-hmm. And I read lots of articles, they said sometimes other people notice that first. Sometimes you yourself notice that first. But I know my case, I know. I cannot bring the words out, abstract words, even simple words. Okay, the craft,
okay.
the past.
Thank you. Can we get the doctor maybe to talk about
it? Here. So what is, at this point, where am I?
Yeah. Well, it sounds like your doctor has done a thorough workup. And he or she, again, I'm not sure exactly what they did, but this could be normal aging. Like you mentioned, it could be a cultural difference too. So sometimes we try to do specific memory testing with an interpreter also in the native language to truly get accurate results. But it's definitely something to follow up with your primary care physician if you're still concerned that it's not normal for you.
Okay, thank you. You can ask her extra questions after. Thank you so much.
Hi, are you familiar with Doctors Dean and Ayesha Sherzais from Loma Linda University?
Not directly.
Okay, but they came here in August last year and gave a couple of talks. And of course, Loma Linda is a Seventh-day Adventist, right? And that's basically plant-based. And if anyone is interested in viewing the lectures that were given in August, they can go to our website, vsh.org, and look for the Dr. Sherzai's presentation. And they give a talk on the diet as well as, exercises that you can do to prevent Alzheimer's. They are the directors of Alzheimer's prevention at Loma Linda University.
Gotcha. Great. Thank you very much for that information.
We have time for a couple more questions. We have one there.
Yes. You mentioned earlier, and we've seen on your graph, that we invested a lot of time with decreasing heart disease. How can we, as an audience, our community, get or convince researchers or medical professions to now focus on this devastating illness?
That's the million-dollar question. I think it starts with advocacy. And I think with Alzheimer's, I don't want to speak for them, but the Alzheimer's Association here is a great organization, not only to get support, but to help promote advocacy, starting at a local, I think starting locally with our local law, our politicians. There is, Alzheimer's Association has a walk. I think it's in October or November this year to help promote the awareness and raise funds for Alzheimer's. So I think it's all about spreading the word, starting locally. The Alzheimer's Association in general, nationwide, is doing a lot right now to promote with our politicians policy changes and research funding. But it's still difficult because there's a lot of things going on right now. But I think what we can do is, support the local organizations here and support our local politicians here to promote advocacy for Alzheimer's and dementia in general.
Okay, last two questions.
Hi, I have a question. This pertains to perhaps prevention for myself. My father came down with dementia. He would, all day, he would not do the things that he used to love doing. He just sat and watched TV all day. Mm-hmm. And then it was explained to me, he's suffering from dementia. How it applies to me is because I talked to several doctors, and they're very hesitant to discuss it because it's a very touchy subject. My father's hobby involved over 20 to 30 years long-term exposure to very toxic chemicals that are banned. Some of them are banned now by the EPA. And I was exposed to those chemicals too. So there's a strong suspicion from the doctors, and especially from some of my relatives, that led to his dementia and his early passing. So does any of the doctors here have any recommendations for like a chemical flush?
Yeah, I wish, and I'm sorry to hear about that. There's nothing that I know of, unfortunately, to try to flush the toxins out of your system, or a way to diagnose what toxins are there in the body from the exposure. We don't have that capability right now. But I think the best thing to do right now is, because it runs in your family, your father has dementia, and that you've been exposed to these toxins that could contribute. The important thing is to do like those tips that I recommended, start today, to try to prevent the onset of dementia. There's a lot you can still do.
Okay, and our last question.
Hi, it's me again. One last question. Inflammation. Does it have anything to do with Alzheimer's or dementia? And does it cause it?
It possibly can. Yeah, inflammation can be from stress. It can be from physical stress, like infections or certain autoimmune disorders. There is a linkage with inflammation and brain damage. So there is a link. What we can do about that is, again, trying to decrease the inflammation, so treating what medical conditions might cause it and trying to relieve stress. Easier said than done. But those are ways that we can combat that. There is an association.
All right, thank you. Let's give Dr. Gina Fukami a great round of applause. And this is going to sound like an Oscar speech, but there's a lot of mahalos tonight. Mahalo, of course, to Val Milstein for providing the sign language interpretation. Also want to say thank you to Tanya Hammond-Tullis from the Alzheimer's Association. Aloha chapter, she's in the back there waving. She provided all that wonderful information. The line for all that information was longer than our check-in line. Also want to say mahalo to our 3 volunteers. You can see 2 of them there, James, Lon, oh, and Julie back there who helped on a Wednesday night. Thank you so much. Our next Speaking of Health lecture is on stroke. May is National Stroke Awareness Month. And so we're going to have Dr. Ronnie Salem, who is a vascular neurologist and neurohospitalist at the Queens Medical Center, talk about stroke, signs of stroke, risk factors, changes in treating stroke in the first 24 hours, modern strategies for stroke prevention, new areas of research, and possible future treatments. That's going to be on Wednesday, May 29th, 2019, from 6 to 7 p.m. here at the Queens Conference Center. And you can register online at queens.org, click Classes and Events, or call our Queens referral line at 691-7117. Thank you all for coming this evening and joining us for Queens Speaking of Health. Don't forget to get your parking tickets validated in the lobby. Drive safe and have a good evening.